Ciao mundo, hello world, hola mundo, hello monde, ni hao. We're here today in another journal club of blood purification, and I was reading the paper for you entitled Association between Extreme Values of Markers of Chronic Kidney Disease, Mineral and Bone Disorders compared to 5 years mortality among prevalent hemodialysis patients. This paper, published by Dr. Zhu from the Tongji University Center, practically describes in a retrospective analysis of more than 1,000 patients the important association between CKD-MBD markers and mortality. In particular, hypercalcemia was found to represent an important risk factor for mortality, while hypophosphatemia was not only for all-cause mortality correlated, but also specifically for cardiovascular mortality. And finally, the values of intact parathyroid hormone also correlated with all-cause mortality. So today we can say that in a prevalent dialysis population, the altered levels of markers of CKD-MBD not only represent an important issue to be corrected, to be treated, but also they may describe a class of patients in which mortality risk is definitely higher. At this point, the maximum effort should be done to correct the values and to treat the disease that is underlying the condition of these markers. Not only that, but prevalent population represent patients that might have been long before these risk factors, and therefore in the pre-dialytic phase and in incident patients, these are parameters that should be studied. So we want to commend Dr. Zhu for having pointed out the importance of these markers not only as a level of derangement or something to be corrected in this moment, but rather something that identifies the typical patient at risk that needs to be considered one of the unmet needs in clinical dialysis. All attempts with new techniques, new pharmacological agents, and new dietary restriction or imposition should be considered to avoid this. With this, I invite you to read this paper in Blood Purification, again, association between extreme values of markers of chronic kidney disease, mineral and bone disorders, and 5 years mortality among prevalent hemodialysis patients. Have a wonderful, wonderful day.